Okay, so this is chapter 21. We're going to talk about training for anaerobic and aerobic power. Again, this will be a bit more of a lengthy lecture, so I'll try and break it up as best I can for you guys. Some of these things are going to be familiar to you as well, so if you are comfortable with those concepts, you can skip ahead as well. So again, the chapter objectives, reference back to these if you're curious of what you need to know, but I'm going to skip through these for the sake of time. Okay, so first we're going to talk about exercise training principles. So stimulating structural and functional adaptations to improve performance in specific physical tasks remains a major objective of exercise training. So the basic approach to physiologic conditioning applies similarly to men and women within a broad age range, and both respond and adapt to training essentially in similar ways. So I've talked about this before, but what you're trying to do is you're trying to train for your objective. So if you're a sprinter, you're going to train to do sprints. So you're going to be doing more explosive power exercise. You're going to be doing more shorter runs. You're not going to be going and running marathons. So make sure that you're being specific to the sport that you're training for. So next is the specificity principle. So when we're training for something, we want to make sure we are specific to that objective. So number one, exercise training specificity refers to the adaptations in metabolic and physiologic functions that depend upon the type and mode of overload imposed. So let's go back to the example of a sprinter. So if you're training to be a sprinter, you want to make sure that the mode of overload that is imposed is specific to sprinting, which will cause these metabolic and physiologic changes where you might get more type 2 fibers, for example. So you're going to get that adaptation to your sport. Number two, the most effective evaluation of sport-specific performance occurs when the measurement most closely simulates the actual activity and or uses the muscle mass and movement patterns the sport requires. So again, with sprinting, we want to simulate sprinting as much as possible. So you're going to train like a sprinter, you're going to run like a sprinter, you're not going to be running super long distances, you're not going to be doing all this like very slow aerobic activity. You're going to do very hard and fast anaerobic activity so you can get the adaptations necessary to perform like a sprinter. So this slide is basically just representing the exercise duration against the different type of energy pathways that we typically use. So I've talked about this already. If you guys are doing very like short bursts of power or really quick bursts of activity, you're going to be more related into these immediate or short-term non-oxidative systems, or these, glycolytic or anaerobic systems that we're going to have to touch into as you do this more high-intense activity. And then these other activities that take longer are going to be more aerobic. So next is the overload principle. So achieving the appropriate overload requires manipulating a few different factors. It could be the frequency of how you do exercise. So instead of doing it twice a week, maybe you're doing it 3 or 4 times a week. It could be the intensity of exercise. So if you're working at, let's say, like 50% heart rate max, you might work at 75% heart rate max. It could be the duration of the exercise that you're doing. So instead of working for 30 minutes, maybe you're doing 45 minutes. Or it could be a combination of all of these things. Now, the concept of individualized and progressive overload applies to athletes, sedentary persons, disabled persons, or even cardiac patients. And if you guys are getting into the health sciences or physiotherapy or chiropractor, you guys need to know that this applies to literally everything. So if we do too much with someone and we overload too much, that can be problematic because that person might kind of blow up. They might be really sore for a few days. And if you do too little, you're not going to see the changes that you need to see in order to help that person improve. So that applies not only to the regular active person, but that also applies to patients that come into your clinic as well. So we're back on the specificity principle again. And specific exercise elicits specific adaptation to imposed demands. So this is the SAID principle. So essentially what we're trying to say here is if you are training for a specific um, purpose, you're going to get these different training effects that will produce specific performance improvements. So again, go back to that sprinting example. If you're going to train a sprinter, you want to train in a way that's going to create effects that give them better performance. So for example, if you were to do specific overload for short duration, that will induce specific strength power adaptations. So that goes into that sprinting example. But if you're training, let's say, a marathon runner or a cross-country skier, this specific endurance training elicits specific aerobic system adaptations. So you can see based on what system you want to train, you need to be specific in the training that you impose on that athlete. So next we'll talk about the specificity of the VO2 max system. So when you're training for specific aerobic activities, let's say marathon running, for example, overload must engage the appropriate muscles required for that activity. So in that example, it would be the legs. And number two, it should provide exercise at a level sufficient to stress the cardiovascular system. So if you're just training this person to walk and they're not getting that stress in the cardiovascular system, well, they're not going to get any faster, right? So we need to have that little bit of overload, that little bit of stress that allows them to continue to adapt and improve. Little improvement is noted when measuring aerobic capacity with dissimilar exercise. So again, being specific and training for that activity that they want to do is very important. The greatest improvement occurs when the test exercise duplicates training exercise. So again, we're beating a dead horse here, but it is the same thing that we've talked about through these first 5 or 6 slides. Now, specificity of local changes. So overloading specific muscles with endurance training enhances performance and aerobic power by facilitating oxygen transport and oxygen used by trained muscles. So the muscles that we use, let's say for marathon running, will primarily be our legs. And if we're able to overload those specifically in a progressive manner, we're going to actually facilitate those muscles' ability to consume and transport oxygen to them so they can get the energy that they need. There is also greater blood flow in active tissues, which results from increased microcirculation, more effective redistribution of the cardiac output, and combined effect of these two factors here. Adaptations occur only in specifically trained muscles and become apparent in exercise that activates this musculature. So you guys can see, you got to be specific and you have to overload in order to get really good changes for the athlete at hand. So here's an example of training specificity. I've already talked about sprinters, but here's a swimmer. Okay, so this swimmer, he does treadmill running, and he only sees a 1.5% improvement in his treadmill running while he's doing that type of training. But if he gets trained through tethered swimming, which is basically just resisted swimming, you can see that his VO2 max actually increases by 11%. So it's important to train this person specifically to the task they are doing so that they can get the improvements that they need to perform better. So next is the individual differences principle, and this is very, very important. This basically encompasses the fact that we are all different as human beings. We all react differently to different stimuli. We all react differently to training, and that's very important. And you need to be able to meet people where they're at so that they're not trying to do something that they're incapable of doing, or they're maybe not doing something that's specific to what they want to do. So optimal training benefits usually occur when the exercise program focuses on the individual's needs and the participant's capabilities. So that's why we check in with people when they're doing exercise. You know, sometimes you got to ask people, what do they like to do? Like, what's the goal, right? So be very aware of this difference between people when you are working with them. So next is the reversibility principle, and this one basically means use it or lose it. So we actually can see detraining effects happen very quickly after someone stops a training program. And sometimes that can happen as quickly as 1 to 2 weeks after they've stopped. And usually what we see with athletes is they'll typically continue on doing a little bit of training and maintaining a little bit of their, you know, fitness levels on the off season so that when they come back to do some preseason training and do some training throughout the season, that they're not having this huge detraining effect that can happen if you just sit around all summer and do nothing, if you play a winter sport, or vice versa if you play a summer sport and you sit around all winter. So next we'll talk about the anaerobic system. So this is kind of that sprint system we talked about, that really quick acting system. And important changes occur within the anaerobic power training system with training. Number one, we get increased levels of anaerobic substrates. We get increased quantity and activity of key enzymes that control the anaerobic phase of glucose catabolism, so glucose breakdown. We get two factors that increase capacity to generate high levels of blood lactate during all-out exercise. Number one is increasing the levels of glycogen and glycolytic enzymes, so the ability to break down this glycogen. And number two is the improved motivation and tolerance to pain. So as you start to get more trained, that burn that you get in the muscles actually starts to kind of soften a little bit, and you get a better capacity to take on more exercise load. Okay, so here are the metabolic adaptations to anaerobic function. So it's kind of what we talked about a little bit last slide. And I don't expect you guys to know these percentages or even the components of this. I think it's just important to realize that this anaerobic system, we start to see this heightened function of it because we have more anaerobic enzymes, we have more glycogen content, we have more of that phosphocreatine system working, we have more ATP going to the system, and we have more glycolytic glycolytic capacity, so that ability to break down that glycogen that we have in our system. So how does training impact the aerobic system? So we just talked about the anaerobic system and some of the adaptations that happen. Now what happens to the aerobic system? So there's 4 categories of diverse physiologic and metabolic factors related to oxygen transport and use. So 1 is ventilation aeration, 2 is central blood flow, 3 is active muscle metabolism, and 4 is peripheral blood flow. So with training, we see positive adaptations to these 4 categories, and that doesn't matter of your race, gender, age, or health status. So if you're doing a little bit of aerobic training, you will see improvements here. So what are the metabolic adaptations? Well, aerobic training can improve capacity for respiratory control and skeletal muscle. So endurance-trained skeletal muscle fibers contain larger and more numerous mitochondria than less active fibers. And so what we end up seeing is this mitochondrial enzyme activity increases by 50%. That makes sense because if you have more mitochondria, you're going to have more activity. So there's your metabolic adaptation. So we're also going to see increases in intramuscular fatty acid oxidation via greater blood flow to the trained muscle, more fat mobilizing and fat metabolizing enzymes, and better muscle mitochondrial respiratory capacity. We also see decreased catecholamine release for the same absolute power output. Now you guys probably recognize a point similar to this in chapter 20 that said it was greater catecholamine release for the same relative power output. Now there's a big distinction there. So if you go on the bike and you pedal at 100 watts, that's your power output. Over time, as you get better at pedaling at 100 watts, you're going to actually decrease the amount of norepinephrine and epinephrine that gets released into the system because you're more trained at that level. Now the same relative power output would be your effort level. So if 100 watts for you when you began was 7 out of 10 as being for difficulty, and then you train for a while and it ends up being 4 out of 10, well then that makes sense that you're going to have less norepinephrine and epinephrine in your system because it's not as hard. But if you were start to pedal at, let's say 150 watts, and that felt like 7 out of 10, well, then you're going to get a greater catecholamine response because your effort level is actually higher. Like you have to work harder um, at a new power output, like a new relative power output, and a new relative um, effort level in order to achieve the same goal. So here are some physiologic factors that limit VO2 max and aerobic performance. So these, again, are those physiological reasons that can limit. There's obviously other factors beyond this, like psychological, motivation. There's lots of things that go into the maximum VO2 max that you can get, but these are the physiological reasons. So I'm not going to go through these in too much detail, but you guys can kind of read through. Just understand a few of them. You don't need to memorize this entire list because that's too arduous. That's too much work. There's so much content to know. Just try to understand a few of them so that you can piece them together when you are going through this content. You can understand the concept a little bit better. So aerobic training enhances fat catabolism in submaximal exercise. And this makes sense. If you guys go back to your hormone lecture, you're going to see that there are actually like hormone changes that actually elicit this fat catabolism or this fat breakdown. So you can see that the energy from carbohydrates that you initially do with training actually falls off, and the energy you get from fat actually starts to increase as you get more trained. Now, part of the reason for this is as you get a little bit more trained, you get the hormone changes, but you also get these changes in your system as well. Like you're starting to build a little bit of muscle mass. Your body's working a little bit more efficiently, so it tends to try to draw from that fat storage a little bit more than it does from the carbohydrate storage. All right, so we're continuing on. We're going to talk about carbohydrate metabolism and the impact on the aerobic system. So trained muscles exhibit enhanced capacity to oxidize carbohydrate during maximal exercise. So it's their ability to kind of break it down and use it. Reduced carbohydrate as fuel and increased fatty acid combustion in submaximal exercise results from three combined effects. One is decreased muscle glycogen use, two is reduced glucose production, and three is reduced use of plasma-borne glucose. So you guys can see that when you start training, you're actually not utilizing as much of the carbohydrates, and you're going to actually get a little bit more of that fat use that we talked about on the last slide. Okay, so how does the aerobic system affect muscle fiber type and size? Well, what we see is that enhanced metabolic adaptations happen for each muscle fiber type. So regardless if it's slow twitch or fast twitch, you're going to start to see this maximization of the existing aerobic potential and these enhanced metabolic adaptations. What you'll typically see, and this goes back to that exercise specificity principle, is that endurance athletes will have larger slow twitch fibers than fast twitch fibers in the same muscle. And it makes sense because the slow twitch fibers are aerobic fibers and the fibers that we need to do more long-term activity, and those fibers are going to fatigue a lot slower than the fast twitch fibers. So slow twitch fibers with a high capacity to generate ATP aerobically contain large quantities of myoglobin. Now you guys are obviously familiar with this term, and you're familiar with hemoglobin. Well, myoglobin is just the muscle's ability to hold oxygen. So of course we want that to happen because that's our aerobic system using oxygen for energy. So here are some cardiovascular adaptations with aerobic training. Again, you guys do not need to know this entire process. We're going to talk about this a little bit more, but this sometimes is a nice visual to go back to so you can start putting some of the pieces together and understanding the entire process together. But don't feel like you need to memorize this picture. Next, we're going to talk about cardiac hypertrophy. So it's the athlete's heart. So what does hypertrophy mean? It's essentially a growth of tissue, right? So long-term aerobic training increases the heart's mass and volume with greater left ventricular end diastolic volumes during rest and exercise. Cardiac enlargement characterized by eccentric hypertrophy and concentric hypertrophy. So what happens is as we train the heart, It's like lifting weights a little bit, right? It has to expand and contract and expand and contract. And as you train, let's say your biceps, for example, if you are lifting weights over time, that muscle is eventually going to grow and going to get more powerful. So endurance athletes average 25% larger heart volume than sedentary counterparts, and training duration affects the cardiac size and structure. So we'll talk about more about this, but this also goes back to that exercise specificity principle. So here's a general trend for cardiac enlargement in untrained and strength-powered and endurance-trained male and female athletic groups. Okay, so you can see that males versus females, we know that males are going to have slightly bigger hearts, and so you're going to see these larger left ventricular masses. We're also going to see that the mass, so what the actual left ventricle weighs, is going to be a little bit heavier in people who do more this kind of power or anaerobic activity than people who actually just do running or more aerobic training. And then you can see in untrained individuals, we actually see this kind of quite average size in ventricular volumes. So here's the athlete's heart versus an untrained heart. Okay, so here's some cardiac dimensions. You guys don't need to know this. I think it's important to understand the trends that happen with training, but you guys don't need to know this table specifically. For the normal person, the untrained person, you can see, you know, what's the left ventricular volume? What's the left ventricular wall width in millimeters? What's the septum width in millimeters? What's our left ventricular mass in grams? And then compare that against people who do more, you know, not necessarily high impact, but doing more anaerobic and power training, like college wrestlers and shot putters, and then people who are more aerobically trained, like swimmers and runners, right? What do we see? What's the difference? Well, we can see that the left ventricular volume increases fairly significantly, especially in aerobically trained athletes. We can also see that we don't see a big change in septum or left ventricular wall width compared to strength trained or power trained athletes. And we'll talk about that a little bit more. But a big significant difference is left ventricular mass. So we start to see this growth in muscle and how much actual muscle mass that we have in the heart, regardless of how you train compared to a sedentary person. Okay, so next we're going to talk about a functional versus pathological heart. And sometimes you'll actually see hypertrophy in people who have disease of the heart. And this can cause, the disease itself can cause significant cardiac enlargement. So when we see a pathological hypertrophy heart, it gets very large and distended and functionally inadequate. And it's not able to pump blood to the rest of the system very efficiently. And this goes back to that Frank Starling mechanism that we talked about a few chapters ago. And if the water balloon gets so stretched out and so large, it actually becomes more inefficient. It doesn't have, it doesn't have that strength in the walls to be able to push the fluid back out very efficiently, and then it just becomes super inefficient. So there's a balance between that. And what we see in the athlete's heart is you're getting this big hypertrophy, but it's actually just because you're way more efficient. Like, it's trained to do that, versus someone who has a cardiac disease. Their heart's not trained to be at that size or be at that level, and then all of a sudden it becomes super inefficient. Plasma volume. So 12 to 20% increases in plasma volume occur after 3 to 6 aerobic training sessions. So plasma volume increase enhances circulatory reserve and increases the end diastolic volume, stroke volume, oxygen transport, VO2 max, and temperature regulation during exercise. So expanded plasma volume returns to pre-training levels within 1 week following training. So that extra bit of plasma that ends up kind of accumulating in your system allows you to be more efficient with your heart as well. So we can see there's a lot of physiological changes that occur with exercise training and aerobic training in particular. Okay, so we'll talk about heart rate next. And training and aerobic training in particular decreases the intrinsic firing rate of the SA node in your heart. And this contributes to resting and submaximal bradycardia in trained endurance athletes or previously sedentary people who train aerobically. Now, bradycardia just means a slowing of the heart rate. What we'll typically see is actually decreases of 12 to 15 beats per minute with endurance training, and we'll see a slight decrease in the resting heart rate as well. And this reduction is pretty much tied to an increase in maximum stroke volume and cardiac output. So you're just more efficient. So you don't need the heart to beat as much because you have better end diastolic volumes, you have better stroke volumes, you have a better cardiac output. So it doesn't need to beat quite as quick. So here's heart rate and VO2 during graded exercise for athletes and sedentary students. So you can see we have in yellow college sedentary students, we have in blue sedentary college students after training, and then in red we have endurance athletes. And you can see that the heart rate versus their VO2 max is fairly significantly different, right? You can see that we still get up to a pretty high heart rate in endurance athletes, but generally that trend is slightly lower than untrained. And then we also see that the heart rate increases at a much slower rate than with untrained athletes. So they get this big peak in heart rate and they're hitting that heart rate much sooner than an endurance trained athlete who's hitting that heart rate much, much later in their VO2 capacity. So stroke volume. We've talked about this already a little bit, but endurance training causes the heart stroke volume to increase during rest and exercise regardless of age or gender. So what are the factors that increase stroke volume? Number one is increased internal left ventricular volume and mass. Number two is a reduced cardiac and arterial stiffness. Number three is increased diastolic filling time. And number four is improved intrinsic cardiac contractile function. So we've gone over this a little bit in the previous chapters, so this should be a little bit of a review for you guys. Okay, so now we're going to compare stroke volume in trained people versus untrained people. So with trained people or endurance athletes, they're going to exhibit a larger stroke volume during rest and exercise compared to untrained people. And you guys already know this from lots of the tables that we've looked at. The greatest stroke volume increase during upright exercise for trained and untrained people occurs in transition from rest to moderate exercise. So you're going to see this massive increase in stroke volume from the time you are resting to the time you reach that moderate intensity exercise. And then after that, it starts to taper off a little bit. In untrained people, you're going to see the maximum stroke volume occurring between 40 and 50% of the VO2 max. In untrained people, you're also going to see a small increase in stroke volume occurring during transition from rest to exercise. So it's kind of that anticipatory factor that goes into the increase in stroke volume. And then finally, in trained individuals, the heart rate and the stroke volume increases to increase cardiac output. So you guys remember the formula for cardiac output. Stroke volume is one of those things that goes into that formula. And when that increases in combination with the heart rate, which is the other part of the formula, we get this increase in cardiac output. So here's the stroke volume response during upright exercise for endurance athletes versus sedentary students. So sedentary students and sedentary college students after training are in the blue, and endurance athletes are in the purple. And you can see that we get this increase in stroke volume from rest when we're not doing anything as we enter into exercise. So you get this big increase right away, and then the stroke volume starts to kind of taper off and level out after that. Cardiac output. So we've talked about this already, right? The biggest change in cardiac output is going to change because of the improved stroke volume. And in trained athletes, the cardiac output increases linearly with VO2 throughout the major portion of exercise intensity. So as your VO2 is increasing, your cardiac output is following that same trend. Next, a training-induced reduction in submaximal cardiac output reflects two factors. So why do we get a reduction in cardiac output at submaximal exercise? Well, number one, you get more effective redistribution of blood flow. So you don't have to work quite as hard. Your cardiac output doesn't have to be as high when you're trained. And number two is that trained muscles enhance capacity to generate ATP aerobically at a lower tissue oxygen pressure. So you don't require as much oxygen in order to generate ATP as you would if you were untrained. So again, you guys have already seen this. We had this exact table in another lecture, but you can see the difference between someone who has a heart condition like mitral stenosis versus the sedentary, and then versus an athlete, and the difference in VO2 max, heart rate, stroke volume, and ultimately their cardiac output. So next is the cardiac output response during upright exercise. Now we're comparing cardiac output instead of stroke volume. So you can see stroke volume had that kind of leveling off at a certain point, but you can see that cardiac output actually follows this linear relationship with our VO2. So as VO2 gets more intense or increases, we also see this linear increase in cardiac output. Next, the AVO2 difference, and we've talked about this too. So when you start to train aerobically, you actually get better at extracting oxygen from the capillaries. So you're more effective and more efficient at pulling out and extracting and processing the available oxygen to actually see this increase in the AVO2 difference as you become more trained. So here's this AVO2 difference again. So you guys can see at rest, the difference is about 5 milliliters, as we talked about in that lecture a ways back. But over time, you can see that when you start doing exercise, the untrained versus an endurance trained person, the endurance trained person has a higher level of extraction than this person who is untrained. So that's kind of the big difference. It's not a super significant difference, but you can see that there is a difference between an endurance athlete and an untrained athlete. Next, we're going to talk about blood flow and distribution related to aerobic exercise. And what we'll see is a lower cardiac output and slightly lower muscle blood flow in submaximal exercise with training. So rapid training induced changes in vasoactive properties of large arteries and local resistance vessels within skeletal and cardiac muscle. So essentially what this is saying is that as soon as you start training, you're going to start seeing these changes in your vessels. And the vessels usually just offer less resistance to blood flow. So you're getting more blood flow. It's easier for the blood flow to get there. It's less restrictive, and therefore you're getting better blood flow to your skeletal muscle and your cardiac muscle as well. The second thing is that you get muscle cell changes that enhance oxidative capacity. So you're actually starting to see, an increase in potentially that mitochondria levels in the muscles that allow for oxygen to be consumed more efficiently. So next is going to be the change in blood flow and distribution during maximal exercise. So what happens to the distribution of blood when we're doing full-out exercise? Well, number one, we get better blood flow and distribution because we have a larger maximal cardiac output. We also have greater blood distribution to the muscle from non-active areas. So those areas that don't need as much blood, let's say your stomach and your kidneys and your intestines, they can start to divert blood more efficiently elsewhere. And then number three is you start to see an enlargement of the cross-sectional areas of arteries and veins, and you often see this increase in capillarization per gram of muscle. So if you guys remember the concept of capillarization, you're just getting more capillaries to muscles so that they can extract more oxygen and get more nutrients in order to function more efficiently. Next is myocardial blood flow. So the vascular modifications that can happen is that increased cross-sectional area of proximal coronary arteries, possible arterial proliferation and longitudinal growth, and recruitment of collateral vessels and increased capillary density. So the really short way of saying this is like you're just getting more vessels that are coming onto your heart, and you're getting an increase of blood flow to your heart because of that. This will provide adequate perfusion for increased blood flow and energy demands of the heart while you're exercising. Training increases coronary blood flow and capillary exchange capacity from structural remodeling to improved vascularization and more effective control of vascular resistance and blood distribution within the myocardium. So it gets more efficient and more effective at putting blood where it needs to be, and it also kind of restructures itself to have more vessels in the heart, like we talked about a little bit up here as well. Okay, next we're going to talk about blood pressure and the changes with aerobic activity. So what we typically see is a reduction in systolic and diastolic blood pressures during rest and submaximal exercise. And the largest reduction typically happens in people with high blood pressure or hypertensive subjects. So if someone comes into your clinic or your place of work and they come in with a blood pressure of 150 over 95, well, the biggest drop that you're going to see isn't going to be in that systolic number. And obviously the ideal is to try and drag that back down to that around that 120 number. But that diastolic number can come down as well. It just won't be quite as significant. So next we're going to talk about pulmonary adaptations with training. So in maximal exercise, what do we typically see? Well, we see that the VE, or the minute ventilation, increases because we have an increase in tidal volume and breathing rate as exercise intensity increases. So what is VE? Well, VE is essentially the amount of air that is breathed in and breathed out in 1 minute. So what is that total volume of air that's breathed in and breathed out in 1 minute? Now, with exercise, it makes sense that it's going to be a lot higher, and it's going to increase because our tidal volumes are increases because we're breathing in and breathing out a lot harder, and we're also breathing faster when we're exercising. So it makes sense that this minute ventilation is going to be higher as intensity increases. Now with submaximal exercise, it actually reduces this minute ventilation and VO2 ratio, and also lowers the percent of total exercise oxygen cost. So when we're doing exercise that's not quite as hard and we're aerobically trained, well, we don't have to breathe as hard, and we don't have to breathe as deeply or as quickly, and therefore this ratio is going to come down. Also, we start to see that we become more efficient at consuming oxygen. So it doesn't cost as much oxygen in order to function when we're doing aerobic activity. Now, this enhances exercise endurance for two reasons. Number one, it reduces the fatigue of ventilatory musculature because you're not breathing as hard. And number two, you get oxygen freed from use by the respiratory musculature, and it becomes available to active locomotor muscles. So instead of wasting oxygen on your breathing muscles like your intercostals or your diaphragm, you're going to start using that oxygen on your legs or your arms or whatever's allowing you to do movement. So training increases tidal volume and decreases breathing frequency, which increases the oxygen extraction from inspired air. So it increases the amount of air that you breathe in, but decreases how frequently you have to breathe. So next we can see that training may benefit ventilatory endurance. So training enhances the ability for sustained, exceptionally high levels of submaximal minute ventilation. Training also increases inspiratory muscle capacity to generate force and sustain inspiratory pressure, which is benefiting exercise performance by reducing the overall exercise energy demands because of less respiratory work. So the muscles of your rib cage and your diaphragm are not working quite as hard. It reduces lactate production by ventilatory muscles during intense prolonged exercise. So as you become more trained, again, you get less of this lactate buildup, and you get that less painful response to exercise. And then number three, enhancing how ventilatory muscles metabolize circulating lactate as metabolic fuel. So it gets better at metabolizing the lactate and using it as fuel when you are doing a bit more uh, lactic inducing activity. So next we'll talk about blood lactate concentration. And we did do a blood lactate lab a little bit earlier this semester, and it didn't really work out the way we wanted to, but I think you guys understand a little bit better, at least the ones who were there, that blood lactate is more driven through the anaerobic phase than it is through aerobic activity. However, what we see in endurance trained athletes is that we get this lowering of blood lactate levels, and we actually get a slowing of the onset of blood lactate accumulation during exercise of increasing intensity. Now, how does that happen? Number one is we get a decreased rate of lactate formation during exercise, and we also get an increased rate of lactate clearance during exercise. So the more trained you are, the better your ability to turn over lactate is. And then obviously you can get a combination of these two things happening as well. So just that increased efficiency again with aerobic training. So here's the response for pre and post training lactate accumulation during graded exercise. So you can see the pre-training in orange, and then you see the post-training in yellow here. And you can see that the post-training people, they get that decrease in blood lactate accumulation until later on in exercise intensity. So the exercise, or this VO2, or this exercise intensity down here, that lactate accumulation happens much later than in someone who is untrained. So there's 4 additional aerobic training adaptations that occur. Number 1 is the obvious one. You get favorable body composition changes. You're getting more lean, getting more muscle mass. You're getting more efficient body heat transfer. You're getting enhanced endurance performance. But one of the ones that we tend to overlook a little bit is the psychological benefits. They're becoming more apparent now. So we can get this reduction in anxiety. We get this reduction in neuroticism. But we want to make sure that we accompany that with professional treatment. So we want to make sure we're pairing up this person with the correct tools that they need in order to get the best performance necessary. This doesn't always apply to athletes. This can apply to the everyday person. So physical activity can be a big help to these psychological components, but it's really good to get that person paired up with a mental health professional as well if they require it. We also see this improvement in mood, self-esteem, and self-concept, as well as a reduction in various indicators of psychological stress. Next, we're going to look at cycling performance. So we're going to be looking at the drop-off from the initial work rate and exercise duration. So let's say we started this person at 200 watts of cycling. You can see that with training, they get better at maintaining that power output over time. So they're not getting this drop off and not fatiguing quite as quickly as well. So here are some of the adaptive changes that happen in active muscles. And what we tend to see is that adaptive changes, they will get these big increases when we're doing training. But if we really regress the training or we stop training altogether, you can obviously see there's a huge drop off in all of these factors. So you don't need to necessarily know this specifically because we've covered this before, but if you want a visual to represent what we've talked about, this is a good one. You can see the detraining effects that happen later on. So next we're going to talk about factors that affect aerobic training responses, and there's 4 of them. Number 1 is your initial level of aerobic fitness, and we'll talk about this more on the next slide. We also talked about training intensity, frequency, and duration, and that goes into that overload principle that we talked about earlier in this chapter. So let's talk about the initial level of aerobic fitness. So the magnitude of training response depends on the initial fitness level. So someone who has a really low fitness level, they have a ton of room to improve, right? They can improve significantly from a low aerobic fitness level versus someone who's very highly trained, they don't have much room to move. So aerobic fitness improvements with endurance training range between 5 and 25%. So you can change fairly significantly, and it depends on the person a little bit, but also depends on this initial level. So next we'll talk about training intensity, and training induced adaptations rely on that overload principle. So if you're not overloading it, it's not going to adapt. If you overload it too much, there could be consequences as well. But we need that overload for adaptations to happen. So how do we express intensity? Well, it could be the energy expended per unit of time. So how many calories did I burn per minute? What is the absolute exercise level or power output? So how many watts am I pedaling at? What's the relative metabolic level expressed as a percent VO2 max? So what percentage VO2 max am I working at? Am I exercising at, below, or above the lactate threshold? So how many millimoles of lactate is my threshold, and am I working at that threshold or above or below it? What's my exercise heart rate or percent of my heart rate max? So maybe I want to work at 70% of my heart rate max. What are the multiples of resting metabolic rates, or what are the METs that I work at? And the most obvious one, and the one that's probably most frequently used, is how hard is this on a scale of 0 to 10? Or how hard is this on a scale of 6 to 20, which would be related to your heart rate. So 6 would be 60 beats per minute, and 20 would be 200 beats per minute, for example. So they put 14 in here as an example. But usually you can just ask someone, how hard is a 0 to 10? So here's a relationship between heart rate max and VO2 max. You guys don't need to know this specifically, but you can see that there is a relationship here. So as the heart rate increases, you get X percent of your VO2 max. That is usually fairly reliable and valid as a measure. So next we're going to talk about training at a percentage of heart rate max. And usually what we see is that aerobic capacity will improve if exercise intensity is between roughly 55 and 70% of your maximum heart rate. Now, with lower body exercise, that will equal a VO2 max of about 40 to 55%. So if you guys go back to that table where you get that correlation between heart rate and VO2, you'll see roughly that percentage kind of line up with this heart rate percentage as well. So the heart rate threshold can be calculated via the Karvonen method. And so that's this formula here. And you guys don't need to memorize this formula. I would never ask you guys to memorize a formula. But I think it's just a nice way of you guys calculating things. If you were working, let's say, with a person or an athlete or a patient that wanted to start working on their aerobic fitness a little bit, this would be a way that you could calculate that. So as aerobic fitness improves, exercise level must increase periodically to achieve the desired exercise heart rate, because we know that as you get more fit aerobically, that heart rate starts to depress a little bit and it gets a little bit more efficient at pumping blood. So achieving that higher heart rate requires a little bit more work. So if exercise intensity progression doesn't adjust to training improvements, then the exercise program just becomes a lower intensity maintenance program. So we know that the heart rate changes over time. So we need to be able to increase and turn up the volume a little bit on our exercise intensity so that we can continue to improve. Achieving positive training adaptations does not require strenuous physical activity. For a healthy person, a heart rate of 70% heart rate max represents moderate activity without discomfort. So this intensity is usually called conversational exercise, and it's called that because you should be able to maintain a conversation with somebody. So if you are working with a client and they're breathing so hard that they can't talk to you, they're probably working a little bit too hard for this particular goal. That's not to say you can't work them out that hard, because there are benefits to that in other areas. But if you're just looking for improving your aerobic fitness, you don't necessarily need to be working at that super high rate all the time. So this basically indicates that there's going to be a decrease in discomfort with exercise. You're not going to get this massive lactate accumulation, and that's going to allow you to still improve without having these negative sensations that some people sometimes associate with exercise. A previously sedentary person does not need to exercise above this threshold to improve physiologic capacity. So you don't need to be going crazy with people, especially people who have not been working out before, right? You want to slowly transition them into exercise. This will help them kind of not only get these adaptations and these physiologic capacities to improve, but you're also going to get the buy-in from that person as well, because they're not going to feel super uncomfortable. They're not going to feel super sore, and they'll get a positive response from that, instead of if you exercise them super hard, they're going to be so sore. And usually humans don't like pain, so they're going to associate that negatively to exercise, and they generally won't stay on board with the exercise plan. So here's an improvement in exercise heart rate response with aerobic training related to VO2. So you can see before training, the heart rate increases pretty significantly with increased intensity. But after training, we see this slower response to heart rate with increased intensity. So your heart is just getting more efficient at pumping. Your body is getting more tolerant to exercise, and you're able to handle a lot more before you're hitting that peak heart rate with exercise intensity. So next, we're going to talk about determining the training sensitive zone. So this is training at a percentage of heart rate max. So your age predicted maximum heart rate is obviously 220 minus your age, but there is a modified equation that you can use. So it's this 206.9 minus 2/3 of your age, and that can also determine a heart rate max as well. Now this is a graph of heart rate max and the training sensitive zone for aerobic training for men and women of different ages. So remember, we're trying to look for ways that we can elicit aerobic changes in people. And so we talked about that 55 to 70% range as being a good range, but this is another way of looking at it. So you've calculated this age predicted heart rate maximum at all these different ages. And now we're looking at, like, where is this area that we can elicit the most aerobic change? So you can see that it can vary quite a bit in a younger person, and still quite a bit in older people as well. But you don't have to be working up in this super high heart rate area to elicit aerobic changes. You also don't want to be working too low as well. So there's this nice big gap of space that you can work in for heart rate targets that allow you to create aerobic changes. And then this graph is just a comparison between that modified heart rate max formula versus the common 220 minus your age equation. And you can see that with age, it actually, you can see that that maximum heart rate can kind of change slightly. And this modified equation is becoming a little bit more commonly used. The 220 minus age is just a very easy way of predicting heart rate. And you can see that's probably a little bit more accurate in younger populations, but it might not translate and be quite as true in the older populations. So you can see this new equation is showing a different trend than the 220 minus age equation. So now we're going to talk about running versus swimming and other forms of upper body exercise. So heart rate max during swimming or performing other upper body exercises averages 13 beats per minute lower for trained and untrained than for running. Now, why does this happen? You get less feed forward stimulation from the motor cortex to the medulla during swimming. You get less feedback stimulation from smaller active upper body muscle mass in swimming than you do with your legs during running. And the horizontal body position and cooling effect of the water during swimming can also kind of reduce that heat response and reduce how much energy is being output during the swimming exercise versus running, when your body heat tends to, ramp up a little bit more because you don't have the cooling effect of the water. Now, training at a perception of effort. So this is that rating of perceived exertion, or RPE, that I talked about. So this would be that 0 to 10 scale, or that 6 through 20 scale that I talked about. So this is using the perceived feelings relative to exertion level. So This is most commonly used in exercise science because it's not always easy to hang your hat on someone's heart rate or hang your hat on their blood pressure. And sometimes you just have to ask a person how hard it feels. And that can give you a really good idea of where they're at. So this is where we use the talk test or some of that conversational exercise to determine where they're at on this effort level. And this is the RPE scale here. So you can see on this one, they scale it from 6 till 20. There would be a 20 here, which would be max heart rate. But you can see 6 would be about 60 beats per minute. And this is the very, very light. So they feel like they're hardly doing anything or they're resting. And then it starts to kind of progressively get a bit harder. And then they do provide some equivalents to heart rate max and VO2 max here as well. Just some approximations to follow if you're wondering where they're at on the scale relative to heart rate or VO2. So the next thing you could do is train at the lactate threshold, and exercising at this lactate threshold or slightly above it is actually quite effective. So the higher exercise levels produce the greatest benefits when related to the lactate threshold training. And we need to evaluate the blood lactate and exercise intensity relationship, because what ends up happening is your body gets more adjusted to the stresses of exercise, and therefore that lactate buildup doesn't happen quite as quickly. So you end up having to adjust your intensity just like you would in the heart rate method. But there is a distinction between the percent heart rate max method and the lactate threshold method of training. The percent heart rate max method is the level of exercise that will overload your central circulation system. So it is just stressing out that central circulation that we need to stress out in order to improve aerobically. And the lactate threshold method is the capacity of the vasculature in the active muscles to sustain steady rate aerobic metabolism. So when we exercise at a steady rate, eventually you start to get a burn in your muscles, and that's that lactate buildup. So your capacity to be able to maintain that rate without getting the burn is that lactate threshold method that we talk about. So here we go, blood lactate concentration in relation to running speed. So I told you guys you're going to get this big buildup when you're going really hard, really fast. When you're running, let's say here at 20 kilometers an hour, you get a massive increase in lactate buildup. However, when you're running a bit slower and you're just, taking it nice and easy, you don't get quite as much lactate buildup in those slower speeds. So next is the training duration. So this is the amount of time that you're actually spending doing a particular exercise or activity, but there's no duration threshold per workout that exists for optimal aerobic improvement. If a threshold exists, it is likely dependent on the interaction of 4 variables. One is the total work to accomplish, so that's the volume of work in that time. It's the intensity within the time, the frequency that you are doing this throughout the week or throughout a period of time, and your initial fitness level. So this kind of determines how much training duration in one bout that you'll be able to handle. So next is training frequency. So usually when we talk about frequency, we're talking about how many times you work out during the week. What we see is that when you're working at a lower intensity, more frequent training produces more beneficial effects. So that extra bit of exercise that you're doing increases your calorie expenditure, and then that provides you with these improvements in well-being and health. So sometimes what we'll see is we'll actually see like weight loss. We talked about those psychological improvements as well. So there's a lot of benefits to these lower intensity activities with training. Now, if you're trying to produce weight loss, each session should last a minimum of 60 minutes at a sufficient intensity to expend 300 calories or more. Now, I'm going to say that this point here, we're starting to see some different evidence about this now, especially with people who are just starting to do a little bit of activity, people who are kind of a bit bit unfit or are obese, they need to be introduced to exercise a lot more slowly than this. So if you get a client that comes to you and their goal is to lose weight, I would absolutely not be following this rule. I would be doing very small bouts of exercise that allows them to feel successful and you're not blowing them up. Because if they're not used to doing it, they're going to have a very hard time following this rule here. So don't follow that necessarily as a golden rule. Usually aerobic training programs take place 3 days a week with rest days separating them, but this can vary from person to person based on preferences and how they tolerate the exercise as well. Okay, so next is exercise mode. So how are we actually exercising? What activity are we doing? Well, actually, it doesn't really matter as long as you're maintaining the intensity, duration, and frequency, and you're using those larger muscle groups. Like in these examples here, you'd be doing a lot of leg muscle work with your exercises. So the actual mode of exercise doesn't really matter, and the only time it does matter is based on the specificity concept. So if you guys remember the swimmer that we talked about, the swimmer did some running, they saw a very small percentage increase in VO2 max, but then when they actually did swimming specific exercises specific to their sport, their VO2 max increased fairly significantly. So you got to make sure that if that person has something that they want to do or something they're trying to work towards, that you're working in that vein of exercise. Okay, so you have a patient or a client, or even for yourself, you've started to do some exercising. Now, how long is it going to take before improvements occur? Well, for aerobic fitness, usually it takes several weeks. And then those adaptive responses will start to level off once they kind of hit their peak based on their genetics. Cardiovascular adaptations occur with short-term exercise training in young men and women. So we can actually see that there are changes that happen in the cardiovascular system very quickly, but we'll start to see other effects a little bit later on within that several week timeline. Now you can see that we get these continuous improvements in VO2 max during 10 weeks of training. Now, 10 weeks of training is not super long if you're an elite athlete, but if you're untrained, you can see that if you're training, you're going to start to see this linear increase in your VO2 max. And eventually what will happen is that will start to level off as they reach those genetically predisposed maximums. So next we're going to talk about genetics and training. And regardless of what your genetics are, if you do some type of exercise, you will see changes. That is irrelevant when it comes to genes. But what is important with genetics is that there is a limit for developing fitness capacity based on your genetics. So there are some people who are just more naturally endowed, so to speak, or they have the genetics for it and they're able to adapt a lot quicker to exercise. They can handle more maximal aerobic and anaerobic activity, and allows them to make those adaptations much more quickly and at a higher level than someone who doesn't have the genetics for that. So we look at the elite athletes, for example, in the Olympics that just recently happened, and those athletes, they have, not to say motivation isn't part of it, but they also have that natural endowment that allows them to perform at that high level. So next we'll talk about peak performance and tapering. So before competition, athletes will taper down their training by reducing the intensity or reducing the volume to reduce the physiological and psychological stresses and allow them to optimize their performance. So the taper period and alterations vary tons by each sport. So every person reacts differently, every sport's a little bit different as well. But here's a couple examples. So you might see a tapering of 1 to 3 weeks so that you can still maintain the training intensity, but you're not doing quite as much training. And so this allows you to maximize your performance gains when it becomes competition time. From a physiological perspective, usually that 4 to 7 days of rest or decreased training provides time for the muscle and the liver glycogen to replenish. It allows people to regain their energy by consuming good foods, getting some good rest, and it also allows them to alleviate some residual muscle soreness and heal some of the minor injuries they have right before competition. So we can see that there is a balance to how much training you're doing. Training hard all the time is not always the optimal way to get the best performance. Okay, so next, how do you maintain gains for aerobic fitness? Well, we talked about how you improve aerobic fitness, and we also talked about detraining and how fast you can lose the improvements. But how do you just maintain a certain level? Well, the short of it is that you just need to maintain the intensity. So if something feels 7 out of 10 difficult, then you're going to want to maintain that intensity with your exercise. Now, the nice thing is if you're just trying to maintain a certain level, as long as your intensity stays about the same, the frequency and duration that you spend on that particular exercise will reduce. So you don't need to spend quite as much time at that intensity, or you don't need to spend, 4 or 5 days a week working at that intensity in order to maintain it. So intensity is the key factor here. So we just talked about aerobic training, but now how do we train for anaerobic training? So if we are engaging specific muscles in repeated 5 to 10 second maximal bursts of effort, this overloads the energy transfer from intramuscular high energy phosphates of ATP and phosphocreatine. So the use of brief all-out exercise bursts combined with recovery periods represents a highly specific application of interval training to anaerobic conditioning. So, why is this important? Well, physical activities to enhance this ATP PCR energy transfer in a specific sport must engage the muscles at movement speed and the power output similar to the performance of that sport. So if we think about sprinting, if you're doing a 100-meter sprint, we need to engage the muscles at the speed that they need to move at, and we need to compare the power output that you would need to perform at that sport, which is sprinting. So we need to have those really quick bursts of movement in the legs and trying to replicate the power output needed in order to have that really high performance in sprinting. Now, we'll talk about the lactate generating capacity. So to improve the energy transfer capacity by the short-term lactic acid energy system, training must overload this anaerobic energy system. Blood lactate rises to near peak levels with 1 minute of maximal exercise. If you repeat the same exercise bout after 3 to 5 minutes of recovery, this will cause lactate stacking. So this produces higher blood lactate levels than just one all-out effort. So you're starting to just build on top of itself and you're getting these higher levels of lactate in the blood. But you must exercise specific muscle groups that require the enhanced anaerobic function. So let's go back to sprinting again. If you are training to do 1 minute of sprinting, which would be about a 400-meter race, roughly, you're going to go do that 400-meter run, and you're going to get this big burn in your legs from the lactate buildup, and then you're going to take a 3 to 5 minute break, and then you'll go run it again. And that's how you can train your lactate generating capacity, is you're just trying to get your body more accustomed to being at these high levels, and your body will start to learn how to handle that a little bit better over time. Now, aerobic training. Some factors that are formulated in aerobic training. Number 1, the cardiovascular overload must be intense enough to sufficiently overload stroke volume and cardiac output. So this is what we talked about in that heart rate method. We need to overload the cardiovascular system. Number 2, cardiovascular overload must occur from the activation of sport-specific muscle groups to enhance local circulation and muscles' metabolic machinery. So this goes into sports like hockey, for example. Well, we need to make sure that the legs are getting the work to cardiovascularly overload those specific muscles in the legs so that they can do what they need to do when they're playing hockey. Brief bouts of repeated exercise and continuous long-duration efforts enhance aerobic capacity, provided they reach sufficient intensity to overload the aerobic system. So whether you're doing, Tabata style exercise where you're doing 20 seconds on and 10 seconds off, or you're doing kind of like short bursts of exercise for like aerobic training, so you're doing like 5-minute runs and taking a break and then doing a little bit more, or if you're doing like a 30-minute jog, regardless of that, you're going to see improvements. So interval, continuous, and fartlek represent the three common training methods. I'm not going to get into those too much, so you guys can kind of take a look at what the fartlek is if you don't know what that is. So the two major goals of aerobic training. Goal number 1, develop the capacity of central circulation to deliver oxygen, and we've already talked about that. And goal number 2 is to enhance the capacity of the active musculature to supply and process oxygen. And we've talked about that and how it gets more efficient at consuming oxygen and extracting oxygen. Okay, so next we'll talk about interval training. And interval training is repeated activity bouts with brief rest periods. So it allows you to do intense exercise without getting super fatigued. And that can be really nice because it allows you to train at a different level without burning yourself out completely. So what we see is you can actually see pretty quick changes in the skeletal muscle's ability to consume oxygen and also an improvement in performance. So it doesn't take long to see some of these changes happen. There are 4 factors that can impact interval training prescription. So let's say you have a patient come in and they want to train aerobically, they want to improve aerobically. What are some things that you want to pay attention to? Well, how intense are they going? Like, are you going to make them go at 100%? Or maybe you're going to start them going with 75%. You can really change this intensity up. Duration. So how long are they going to do this interval workout for? Maybe they start with 10 minutes. Maybe they're not used to exercise. Maybe they are used to exercising, they're quite trained, and you can do 30 minutes. What is the length of the recovery interval? Are you doing a minute on, a minute off? Are you doing 30 seconds on and 15 seconds rest? What's your recovery interval? And then what's the number of repetitions? So like, how many intervals are you doing? Are you going to do 5? Are you going to do 15? You have to pay attention to these things when you're prescribing exercise to people. So next is a study that looks at the effects of sprint-type interval training on power output, aerobic capacity, and muscle enzymes. So in the yellow, you got your pre-training group, and in the red, you got your post-training group. Now, I'm going to make this super short for you guys. Guess what? They all improve. So your power output gets better, your aerobic capacity gets better, your VO2 max improves, and your muscle enzyme amounts and activity improves as well. So there, you can see that there are benefits to interval training simply by following these graphs here. So next we're going to talk about continuous training, and continuous training is just steady rate exercise for a prolonged period of time. And usually the intensity that is involved with that is 60 to 80% of the VO2 max. The exact pace can vary, but it has to meet a threshold to stress out the aerobic system and stress out that cardiovascular system so we get these aerobic adaptations. Continuous training benefits 2 different groups of people usually. So either novices who just want to accumulate a large caloric expenditure for weight loss, or endurance athletes who want to kind of simulate race conditions and simulate competition. So there are 2 different groups that can be very benefited by this type of training. So next is fartlek training. So if you didn't look it up earlier, here it is. So fartlek is a Swedish word that means speed play. So it's alternating running between fast and slow speeds over level and hilly terrain. And you don't necessarily have to run. If, let's say, you were skating and you skated at fast speeds for a short period of time and then slower speeds for the other period, then that would be another variation on this fartlek training. The nice thing about this is that the performer can determine how it feels, and they can use this rated of perceived exertion to determine how difficult they want to make it for themselves. So that's that 0 to 10 or 6 to 20 scale we talked about. It's also ideal for general conditioning and off-season training, and it adds freedom and variety to workouts. So you can really determine and decide what what how long you want to do the intense running for and how long you want to do the slow running for. So next we're going to talk about overtraining, and I've already talked about this, and this is something that is frequently done actually in lots of sports, and not only just in sports but just in everyday life. It's just doing too much and not allowing this adaptation to occur to our bodies that allows us to get stronger and more resilient to the stresses that we're putting on it. And so when a person fails to adapt to training, performance will deteriorate and it becomes difficult to fully recover from workouts. It also relates to increased incidence of infections, injuries, persistent muscle soreness, just feeling unwell, this general malaise, and a loss of interest in sustaining high-level training. So there's two clinical forms of overtraining. There's a sympathetic form and a parasympathetic form. So the sympathetic form, as you might expect, is an increase in sympathetic activity during rest. And usually what we see is hyperexcitability, restlessness, impaired performance, and potential excessive psychological and emotional stress of that athlete or that person. With the parasympathetic form, we usually see a predominance of vagal activity or this parasympathetic activity during rest and physical activity. So remember that that vagus nerve comes from our cranial nerves, and it is one of the drivers to the parasympathetic system. So here's a schematic overview of overtraining syndrome. You don't need to know this, just skip over it. There's a lot of factors that can go into overtraining, so don't sweat too much about this slide here. Now some definitions that are related to overtraining. So overload, which we've talked about pretty significantly in this slideshow, is the planned systemic and progressive increase to improve performance. Overreaching is the unplanned excessive overload with inadequate rest. So you've done some overloading, but now you didn't get the proper rest that you needed. And usually we see this in training and competition. And usually you can recover within a week or two. But typically what you'll see with people who overreach is they've done a significant amount of training and then they're just so sore from the exercise or from the activity that they just basically can't function properly. So you see this decrease in activity, decrease in performance, but usually that's mitigated by some rest, eating some good food, recovering, and hydrating as well. And then overtraining syndrome is untreated overreaching that produces long-term decreased performance and impaired ability to train. And usually what we see with people like this is you get that, you know, they don't feel well, they've been working out super hard for a long time, their performance usually sucks, and they're also probably accompanied typically with an injury as well because they've been overtraining so hard. So I see lots of patients, they've been doing something either just at work and not even just in sports, where they've been doing something very repetitively for a very long time, and then the body kind of just says, nah, I'm done. And it starts to wear them down and make them feel pretty crappy. So it's something we want to be aware of clinically. So here are some significant effects of overtraining, and I don't want you guys to focus on this slide. There are, like I said, there are a lot of factors that go into overtraining, and we could be picking this apart all day, but don't focus on this quite so much. And then you can start to focus on the actual definition of overtraining and how it relates to your potential future client or patient. So next we're going to talk about exercise during pregnancy, and inevitably we're going to run into women who are pregnant, and they need to be able to know what's safe for them to do for exercise, and it's important for you to know as well so that you're not prescribing something that is inappropriate for them. So in the second and third trimesters of pregnancy, we obviously have this fetus that's growing within the woman in their uterus. So there's going to be increased ventilatory demands because that fetus needs oxygen. It needs oxygen to survive and to grow. And what we can see is that if we do some moderate activity and some regular activity, that will actually reduce the ventilatory demands because you're going to train your system to get more efficient at extracting oxygen and consuming oxygen and just accepting oxygen into your system. Exercise during pregnancy does not increase the risk of fetal deaths or low birth weights, and it actually reduces the risk of preterm birth. So usually we stay in this moderate level. We're not doing this high intense exercise during pregnancies. We're not stressing out the system super high, but moderate exercise is really good. Okay, so what are some physical activity effects on the fetus, and why do we not do intense exercise when we're pregnant? I just talked about this last slide, but here are some risk factors that are involved with intense exercise. Number one, you get reduced placental blood flow, and you could potentially have fetal hypoxia. You have fetal hyperthermia, so an increase in temperature, and then also a reduced fetal glucose supply. So when we are doing this super intense exercise, obviously the oxygen needs to go to the muscles, so it's not going to the fetus. We also are elevating our body temperature fairly significantly, and we can make that fetus actually overheat, which is not very good for a growing baby. And then number three, we have this reduced fetal glucose supply, and that usually happens because we have that increased demand of the muscles that need the glucose for energy, and therefore gets diverted away from the fetus, and that can prevent that fetus from developing and growing as it typically should. So here are some common physical activities for pregnant and non-pregnant women. And what you'll see is that we have some higher intensity exercises like weightlifting, cycling, running, jogging, that are a little bit more risky, I guess, in regards to creating some of those high risk changes to the fetus. And what you'll typically see is you see lots of pregnant women just going for a walk. So you can still get some moderate level activity in, still get your aerobic system working a little bit without stressing out the fetus. So here's the current opinion regarding physical activity in pregnancy. And what you guys will find is that if you see opinions, it's usually based on expert analysis, and that's usually a low level of evidence. So I wouldn't hang my hat on these points, but they're still going to be based and rooted in some research. So there is some validity to it, but I wouldn't hang my hat on this because each person and each woman is going to react a little bit differently when they're pregnant. So in general, 30 to 40 minutes of moderate aerobic activity for a previously active, healthy, low-risk woman during an uncomplicated pregnancy does not compromise fetal oxygen supply, acid-base status, induce any heart rate signs of fetal distress, or produce other adverse effects to the mother or fetus. If performed on a regular basis, physical activity maintains cardiovascular fitness, promotes the training effect, inhibits undesirable excessive weight gain for the mother, and associates with resting fetal heart rate effects similar to a trained response. So in general, physical activity is good for a pregnant woman. However, it's always good to make sure that they've checked in with their doctor, make sure that they have clearance to do physical activity, because there are instances when you don't want to be doing anything beyond really resting level activities such as light walking and just some general activities around the house, and that's pretty much it. There are 4 other positive maternal effects to exercise. Number 1 is shorter labor and delivery time. Number 2 is faster recovery after delivery. Number 3 is decreased pregnancy discomforts, and 4 is there's fewer complications during pregnancy. So you can see that physical activity and exercise obviously have these greater health benefits. Okay, so that's it. We made it through another chapter. The next few slides are going to be the summary. Feel free to reach out, as always, if you have questions. I'll do my best to answer them, and if not, then we can always go to Alana and ask her. But I appreciate you guys sticking it out with me for these last couple chapters. They've been quite long. I'm trying to use lots of analogies for you guys to help you out, and I know that can make the slides a little bit longer. So feel free, if you are comfortable with things, skip through to the next slide. And also, don't be afraid to use that speed up function in YouTube, right? If you're sick of listening to me yap on for an hour and a half, use the speed up function, get the video moving a little bit quicker for you so that you can get through the content as fast as possible and still consume it in a proper way. So thank you guys again. I'll run through these next few summary slides and then we'll be on to chapter 22.